Okay.
Mm-hmm.
We're going to talk about the atherosclerosis. What caused the disease?
Well, thank you very much for interviewing me. I'm really honored that you're here in my office. We're going to talk today about atherosclerosis, which means that is the buildup of plaque and of fat depositions on the inside of blood vessels. That is a process that happens throughout a person's lifetime. It takes a long, long time for atherosclerosis to form. We know that everybody, all of us, will form atherosclerosis throughout our lifetime.
Everyone.
Everybody does.
Right, there's no exception.
No exception. We all form some of it, a little bit of atherosclerosis, which means that in our arteries are the blood vessels that carry blood from our heart to the rest of our organs. With time, they start to become a little harder, and they develop calcium buildups, and sometimes fat depositions on it. And so what ends up happening is that the inside of the blood vessel becomes a little narrower, so less blood can go through it. However, there are some people who develop atherosclerosis a lot faster. And for example, people that smoke the cigarettes, they tend to form atherosclerosis at a much faster rate. Or people that have certain diseases like diabetes. Also, people that have a sedentary lifestyle, when they don't exercise, eat a lot of hamburgers.
And how does it affect current?
As I was explaining you, it's sort of a part of atherosclerosis is part of a human being, but it can become really serious if it grows fast, or if it, in the process of atherosclerosis growing, it might block an artery, and that could be very, very dangerous or disastrous if it blocks an important artery in your body. For example, if one of the arteries that give blood to your heart gets blocked, that may cause the lack of blood to the heart, and people might have a myocardial infarct, or a heart attack, it's also called. And that can definitely be serious. Also, atherosclerosis can form in other arteries of the body, like oftentimes in the carotid arteries that take the blood over to the head, and that could cause a stroke when the artery gets blocked and there's not enough blood going to the brain, and that could cause it's a serious problem.
So, like, if a person has atherosclerosis, like he can't or she can't exercise because of the arteries being blocked, or
that's right. They have to be much more careful with exercise, because exercise definitely helps them. It helps prevent the buildup of atherosclerosis. But also, if they do very strenuous exercise, they might not get enough blood that goes to their heart or their brain. So it's a very important illness, atherosclerosis.
What is the patient's prognosis?
Well, like I said, it depends on the degree of atherosclerosis that people have. The great majority of people only have a little bit of atherosclerosis, and it doesn't impact them at all in their lifestyle. They can live a normal, full life. But however, if patients have significant amounts of atherosclerosis in important arteries of their bodies, like their carotid arteries or your heart arteries, called the coronary arteries, that could be dangerous. And so those people are much at risk of developing a serious illness, like a sudden scenario or sudden death syndrome that could occur.
What was the patient's chief complaint?
Well, I have a patient, very close friend of mine. We became friends in the process of being doctor and patient. But he came to me. He's 75 years old, and he has a problem of being diabetic and has high blood pressure. And because of those two issues, he would develop atherosclerosis faster than other people. And one day he started having some chest pain. and he would say to me that he usually didn't have chest pain, but when he walked or when he exercised, he started having chest pain. And so luckily we diagnosed him with angina, that is pain in your heart from not enough blood flow. And so because of that, we did studies on him, including an angiogram, and we find that he had atherosclerosis in the blood vessels that go to his heart. And so we were able to intervene early enough. And because he had atherosclerosis in several vessels, we did heart surgery on him. And so we bring in new blood vessels to the arteries of the heart so they can get enough blood flow. And so he was really happy because he could now do exercise, and he knows that he's much less likely that he has a heart attack now with his new blood vessels.
What other symptoms does the patient have?
Well, other than the main complaint, like I said, was chest pain, but sometimes he complained of nausea as well, or maybe sometimes not feeling well, like not having enough energy. Also, he was upset because he was limited in his physical lifestyle. This is a person who liked to go out hiking, and now he couldn't hike anymore because he would have had chest pain each time he did that, and so it really was troublesome for him. But luckily, we were able to find it early enough and intervene. I had another patient, just to complete the story, but who didn't do so well. I had another patient who I met him the time he was having a heart attack, and even though we couldn't catch him early enough, and so we tried to care for him, but he had a big enough heart attack that he was not able to live a normal life, and so he survived, but his heart was not strong enough, and so he couldn't do much other than just mainly stay in bed and do limited activities at home.
Okay. How was the patient tested for the disease, and what did those tests reveal?
So in this scenario, in this case, we find atherosclerosis through an angiogram. That's a special study where we inject contrast inside the blood vessels. The patient goes to the hospital. We use a special catheter to put it inside the artery, and then we advance that catheter to the arteries in the heart, and then we give contrast so that we can get a map, a visualization of the arteries in the heart. And we were able to see through that test that the arteries in the heart were narrowed, and so it's a very good study for finding atherosclerosis, but it's invasive. That means you have to go to the hospital, and there are risks with it. Other good tests include ultrasound. Like, for example, to look at the carotid arteries, we use the ultrasound machine. Very simple machine, and it can detect how narrow those arteries are and how difficult it is for the blood flow to go through the artery in that scenario.
Okay. What were the patient's treatment options?
Well, luckily for my first patient, the one who had chest pain, luckily he had alternatives. He had options because he wasn't in a serious. He wasn't at a, how can I say, he wasn't a life-threatening condition. So he could have either had the surgery that he had, which was very effective, but it was also a little riskier, or the other option, he could have chosen to have stents. And stents are metal prostheses that go inside the artery. And so we put them inside the artery where it's narrowed, and we use a balloon to enlarge them, and through that process we can open narrow arteries. There was an option for him. Well, he decided not to have that option because he had atherosclerosis in multiple vessels. He had 4 vessels that had atherosclerosis, and so he would have needed 4 different stents. Because of that, it was a better situation for him to have the surgery. He could have also chosen not to do anything. He could have said, well, I might just live this, but that was a risky situation because he could have had a heart attack. He could have had a heart attack if he didn't do something. But so we were able to advise him on time and prevent a serious issue from developing.
Okay. What would happen to the patient if he didn't receive the treatment?
Well, that's exactly the question. That if he had angina, chest pain, and didn't have the surgery or the stents, most likely he would have had a heart attack.
What treatment did the patient receive and how effective was it?
Well, my patient had heart surgery, and heart surgery is a big endeavor. It's a sorry about that.
Okay.
It's a specialized surgery, so you really need a big hospital. You really need a good hospital. You really need a good doctor and a good anesthesiologist and good nurses and a good whole team to take care of you. And in the heart surgery, we give the patient general anesthesia where he's completely asleep, and then we use a special machine so that we can stop the heart from pumping, and the machine distributes the blood throughout the body. And once the heart is stopped, then we can operate on the heart, and we can bring new blood vessels. For example, we take veins from the leg and put bypasses or bridges between the arteries on the chest and the arteries in the heart. And so it is a big surgery, but however, it's very effective, because with this surgery, once he was able to recover, it is very likely that he will live a full life without even having a heart attack. So that's really good. It's more effective to have heart surgery than to have stents, especially if you have 4 blood vessels that are narrowed.
What new technologies now exist for preventing, diagnosing, or treating this disease?
Oh, lots of things. We're making big progress. We're making big progress in identifying early on who is likely to develop atherosclerosis in their lifetime. So we put a lot of emphasis, for example, in your family history. If we know that if somebody's parents or grandparents died of a heart attack, they're more likely to have atherosclerosis. So we can find those people early on when they're in their 20s or their 30s, and we can follow them. And we can check levels, and we oftentimes check cholesterol levels. And we also have new medicines. We have new pills that block the cholesterol in the blood, and that limits the amount of atherosclerosis that forms. We have better medicines for diabetes. We have better medicines for blood pressure. And if we find this early, we can completely prevent it. Many times we don't find it early, but we still have good treatment options. We have better surgery and better surgeons and more prepared hospitals. We have better stents, and now special stents that last longer. And then we have ways of removing the atherosclerosis from the arteries, special endovascular equipment. We even have the possibility to give somebody a new heart by means of a heart transplant. So medicine has advanced a lot, especially in the cardiology field. There's a lot of hope for somebody who has a disease.
That's all the questions.
Okay. Well, I very much appreciate you coming. I wish you good luck.
Thank you.
Thank you.
You're welcome. You're welcome. Goodbye.
Muchas gracias.
De nada. Nos vemos.